Folks, good morning. Just to let you know how useless NHS services are. I've just been trying to get my tooth fixed because I had a filling come off. I've never used NHS in my entire life. They could not even find my details on their records since I haven't been to see a doctor, been to see anybody. I never trusted medical treatment or anything like that. This is an emergency as I got a pain in my tooth. The permanent filling came off, and they come back and tell me that they can't actually do anything to book me an emergency dental treatment and I should go private. After paying all these years for my national insurance and all sorts, what's the use of NHS, or what's the use of using the facilities that are available? I don't know. I'm told I should go private and I should use salt water too. I haven't eaten for almost 24 hours now because I didn't want to cause any irritation or infection in my tooth. So I know what to do. Use salt water and rinse it. Use a little bit of I've been asked to go and get a dental repair, temporary dental repair kit to fix it. All of this, I have researched it, and I thought maybe I called all the dental surgeries around the local area. None of them are able to take because of COVID and all sorts of other things. And if I'm not registered in the UK for dental treatment, I have done some dental treatment in Japan. Efficient, perfect. And of course, this particular one was done in the UK way back. And of course, it's come apart. What do? I've been asked to take medication, this and the other, painkiller, raise your head above just to keep the pain away. I can't get a medical NHS treatment, NHS emergency fixing until I at least find some sort of a proper dental care to be treated. So here we are. Keep smiling. It's all for the people who sit around and do nothing. People who work hard, do everything they can to avoid dental treatment and medical treatment. Been asked to do a self-fix. How useful can your facilities be? Asking you to go and find a private treatment and nobody is available. So I thought I'll call the facilities that are available to the citizens, and they're not.